Hi, welcome back. So today in this video I am going to be talking about the quadratus lumborum muscles and sort of what to do when they get tight, when you get pain in this area, and sort of what causes tension here. And firstly, I sort of want to start by explaining where exactly these muscles are, because quite often when I talk to my clients about this muscle, they have never heard of it. It's not one that people sort of when they go to the gym, think, oh yeah, I'll work that muscle. So it's kind of quite unknown to a lot of people. So I'm going to start by talking about the anatomy. The quadratus lumborum is actually it's the deepest of those posterior abdominal muscles, sort of on the back of the abdominal wall. But because of the location, quite often, people talk about it as if it's, like one of the back muscles. So, okay, so let's take a look at where exactly these muscles lie. Okay, so you can see the quadratus lumborum muscles on either side of the spinal column. And so they basically sit between the iliac crests of the pelvis on each side and the 12th rib up here. And they also have attachment points on the transverse processes, which are these little bits that stick out off each of the vertebrae. So it also inserts not only on the iliac crest, but on the transverse processes of the 1st to 4th lumbar vertebrae. And we've said it sits on the back of the abdominal wall, which means that the colon, kidneys and diaphragm actually sit in front of this muscle. And the muscles of the back lie behind these muscles. And this is why quite often when a client comes in and they have tightness in these muscles, quite often, you're accessing it sort of through the side, and it can be quite sensitive, and that's because it bypasses the kidneys and other internal organs. Okay, so what do we use the QL muscles for? They actually have quite a few functions within the body. Certainly they're used, to sit, stand, walk, and that's why these muscles are probably one of the main causes of lower back pain. They are used to stabilize the spine and the pelvis. And so quite often they'll be affected, if there's any kind of pelvic tilt, which I'm also going to do a video on. They help to support the core of the body when breathing. If obviously you've got one of the QL muscles on either side of the body, and when there is bilateral contraction, so when both sides are contracting, this helps to fix the ribs during inspiration or breathing in, and allows for extension of the lumbar part of the vertebral column, which is required for movements such as sort of when you arch your back. That's the part of the spine that we're moving. So that's what the muscle does if both sides are contracting at the same time. The QL muscle is also an accessory muscle of expiration, so breathing out, due to its ability to fix the 12th rib during thoracic movement. So movement sort of, in the sort of upper mid-torso. Now, if on the other hand, only one of the QL muscles is contraction, so unilateral contraction, this will basically enable lateral flexion, so bending to the side, either way. And again, I'm going to talk about this more when I talk about pelvic tilt as well, because it's when you get unilateral contraction of the QL that, usually where one side will end up tight, the other side will often end up stretched and weaker. So again, with pelvic tilt, that's quite, quite important. Now, in terms of tightness in this muscle and pain, there are, a few causes of this. As with many of these tight muscles, overuse and repetitive movements is a leading cause. And certainly repetitive movements, when that's combined with weakness in the muscles, can certainly lead to postural problems. Also, sitting for prolonged periods, particularly if you're sitting in a reclined position. Basically, this releases the intrinsic back muscles and weakens them in the long term. And what happens then is that the quadratus lumborum muscles compensate, which then obviously causes pain and tension in this area. But also, by sitting in a reclined position for long periods, this causes continuous contraction of those QL muscles, which results in muscle fatigue. And thirdly, it reduces blood flow to the QL muscles, which again is going to cause tension in that area. Other causes of, QL tightness and pain will be things like if maybe you have a job that involves a lot of lifting and bending, if you're not using good lifting technique, again, this is going to create further tension as the QL, has to kind of overcompensate to stabilize the spine and the pelvis. Poor posture, again, if you're slouching, if you're, leaning to one side when sitting without any kind of lumbar support, and even standing, a lot of new mums, mums with babies and toddlers are known for kind of standing with all their weight to one side, and they've got baby propped on one hip, and quite often they always use the same side, and this again will cause postural changes and just place extra stress on those QL muscles. So you're going to end up again with one side contracting, one side is going to be tight, and the other side is going to be stretched out and weakened. Another cause is if, the surrounding muscles around the QL, if there's any weakness in those muscles, this again will probably cause the QL muscles to work harder and overcompensate, in order to support the torso. Also, any kind of pelvic or spinal imbalance. Now, this could be something like maybe an unequal, leg length, which will cause a lateral pelvic tilt, which again I will go on to talk about in another video. But this means that the QL has to work harder again to stabilize the spine and the pelvis. Another cause is any kind of trauma or direct injury to the area. So this could be something like a car accident, or maybe some kind of sports injury. And this again is going to lead to pain around those muscles. Okay, so I've talked a little bit about unilateral contraction. So where only one side contracts. So I'm going to talk a little bit about asymmetrical tightness of the QL. So obviously, in a normal, good posture, neutral position, you've got your QL on either side of the spine, and they're both equal lengths, equal, levels of tension, and they both, the impact of stress on these muscles is going to be equal. But of course, more often than not, QL tightness will occur on one side only, due to our tendency to hold the body in a slightly tilted position, causing an imbalance between the two QL muscles. So when we stand regularly, or even sit regularly, with our weight shifted to one side, the muscles will adapt, causing them to become long or too short. So if you see here, so if we're constantly shifted to one side, and one side of the pelvis is hitched up, what's going to happen is that the side that is hitched up, the QL on that side is going to contract and shorten. And if this is done for prolonged periods, you'll end up with tightness on this side. But then the opposite side will actually be kind of stretching. And again, if this side is becoming tight, what happens is this side, over a period of time, will then weaken, because it will constantly be stretching. And so it will become, the muscle on this side will become too long. Now, also with lateral flexion, it's kind of a similar thing. So again, if you're always bending to one side, maybe the way you sit, again, the side that you are leaning towards, that QL is going to contract and shorten, which is going to really stretch this side a lot more. Hence this side again will become too long. And so that's where you will begin to get a muscle imbalance, which will then have a knock-on effect on the surrounding areas. So what happens in cases of lateral pelvic tilt, and I suggest you watch the video that I'm going to put up on pelvic tilt. What happens is the side on which the hip is hiked up will basically reduce the space between the pelvis and that lower rib where the other end of the QL attaches. So the corresponding QL muscle will become shorter and tighter because it's contracting. The QL on the opposite side of the body will become long and stretched because that hip is sitting lower. So the space between the 12th rib and the pelvis is going to be longer. And so when that is, lengthened and stretched for a prolonged period, you're going to get a weakness on that side. And what that will then do is actually worsen any, lateral pelvic tilt. And, the imbalance, it will just affect the posture further. It will also cause overcompensation of other muscles in, the surrounding areas, which will then place additional stress on other joints and therefore worsen pain levels. Now, in terms of complications of tight QL, the main complications will be pain in your hip joints, around the buttocks and thighs, pain in the sacroiliac joint, which again I'm going to go on to do another video about sacroiliac pain. But basically that's just where the that triangular piece of bone at the bottom of your spine, which is the sacrum, is where that joins on either side to that iliac crest that the QL attaches to. Other complications of a tight QL will be low back pain. Certainly I see that in pretty much every case, that comes into me, where there's tightness, they're experiencing low back pain, and also sometimes abdominal pain. As we've said, the QL does sit on the posterior abdominal wall, so abdominal pain is another possible complication. Now, in terms of symptoms of a tight QL, as we've said, lower back pain. Now that can be on both sides or just the one side, usually dependent on if there's any pelvic tilt involved, or sort of whether it's one or both of the QL muscles that are, contracting. And it's usually either a deep ache or it can be a sharp pain, but usually it's worse with movement as you're bending, twisting, and pulling on those muscles. You may also find that you will experience a sharp pain if you sneeze or cough. Anything that suddenly sort of causes you to push forward, and sort of arch slightly that lower back. Again, that's going to pull on those QL muscles. So pain may also become chronic, if you are sitting or standing for prolonged periods, and that's what's worsening, the tightness. Pain can become chronic, and we know that this leads to anxiety and depression. Tightness in the lower back is also going to limit your range of motion. So again, those bending movements, twisting, sideways, bending, all those movements that use those two muscles are going to be very difficult and uncomfortable. As we say, other symptoms, we've talked about pelvic tilt a little bit, and certainly lateral pelvic tilt, where there's an uneven hip height, is really going to alter the way that those QL muscles sit. And yeah, just generally, you're going to find, through pain and restricted range of motion, you're going to find that you have restricted daily activities. Now, one thing that I've talked about in quite a few of my posts is trigger points. And trigger point therapy is certainly something that I include in a lot of my sports massages to some extent. Now, the QL trigger points may also be responsible for, as we said, a deep ache in the lower back, a stabbing pain in the hips or pelvis, and also a sharp pain, during coughing or sneezing, where that QL is forced to contract. Okay, so if we look at trigger points, sort of latent trigger points that may be activated by the QL trigger points. So we've got QL trigger points in this muscle here. They may actually also cause referred pain and activate latent trigger points in the gluteus maximus, which is the large area of your buttocks, the piriformis, which is one of your deep rotator muscles, sits deep within the buttocks. Also the gluteus minimus, which sits sort of more towards the side, and the gluteus medius as well. And these muscles are also responsible for abduction of the leg, so lifting the leg up out to the side away from the midline of the body. Now, in terms of treatment for a tight or painful QL, addressing this problem is really important, not only to ease pain, but also, to restore the balance to your hips, improve posture, help to correct any pelvic tilt, and also these things will improve any athletic performance, but also just, daily functioning in terms of general activities. But if symptoms persist after 2 weeks of, trying the conventional treatments that I'm going to talk about now, then, you really should be seeing either a doctor or come and see a sports therapist such as myself, and you can sort of see, if there's anything else going on. So in terms of conventional treatments, we're talking about medication. So this will be things like muscle relaxants and anti-inflammatory, sort of pain relief. You can also try heat and ice packs, certainly alternating the two. Ice to reduce any inflammation, and certainly if you've maybe done yourself an injury in the gym, or if you've got a job where you're lifting and you've done an injury that way, certainly ice, to reduce the inflammation, and then alternate that with heat to just relax the muscles and help them, sort of loosen off a little bit, which will also ease pain and improve blood flow into the muscles, which again, when you've got improved blood flow into the muscle, it's going to help to reduce any tension there. Other things that you can do, you can have trigger point injections, which is basically the administration of anesthetic or steroid medication directly into a trigger point. And what this does is it reduces tenderness, inflammation, and also any muscle spasms that are occurring in that muscle. Physiotherapy, as always, they can suggest some exercises that you might be able to do, again, to either, help loosen off a tight QL, or to strengthen, if there's weakness, particularly on one side, they can give you exercises to help strengthen the longer, weaker muscle that's been stretched out. Massage therapy certainly, is actually really probably one of the best treatments for QL tightness. Not only can a sports therapist recommend some exercises to you, again, to relax any tight QL or to strengthen a weakened QL, which will in turn help to stabilize the spine and the pelvis. But in terms of offering treatments such as myofascial release, combined with trigger point therapy, this sports massage type techniques will help to reduce tension again, strengthen any weak areas, and also to strengthen surrounding muscles and improve blood flow into the area, which again is going to help to improve flexibility, improve range of motion, and prevent further injury. Other things you can try are acupuncture, rolfing. Yoga is another good one with QLpain, and also, if you've got QLpain that's sort of starting to become a chronic issue, again, yoga's really good. So obviously any kind of stretching to ease tension in the muscles and also improve range of motion. And again, I'm going to show you some basic exercises at the end of this video that you can do, which will do exactly that. And the other sort of thing that you can do is in terms of just trying to make some changes in terms of your posture. Try to avoid positioning the hips in an unnatural position with one hip higher than the other. If you are a mum, try not to kind of balance your toddler on your hip. And try, when you're sitting, try to maintain a good posture, not sort of sitting to one side, or, just try to sort of sit up straight with your spine in a neutral position and feet flat on the floor. In terms of preventing QL tightness and pain in the first place, again, maintain good posture, whether it's sitting or standing. Use a lumbar support, just to give you a bit of extra support. But also, if you have, say, a sedentary lifestyle or job, make sure that you're taking regular breaks so that you can get up and just, move about a little bit, or just take a wander off, to the loo or for a tea break or something, just to kind of get those muscles working. Staying active, obviously, focusing on stretching and strengthening. Side bends are, basic, but they're really good for, releasing any back tension. And, any exercises to increase the space between that, the lower rib and the pelvis. Things like yoga, Pilates, Tai Chi, walking are all going to be beneficial. Remember, particularly if you've got a job that involves a lot of lifting, remember to bend at the knees, not just at the hips. Use good lifting technique. Maintain a healthy weight, because obviously if you are overweight, that's going to put a lot more pressure on the muscles and certainly around the pelvic area and lower back. And I think we've already said, if you do get symptoms start to arise, just make sure that you get some treatment early and that you don't just put it off and ignore it, because the likelihood is it will get worse. And as I say, then you start having other muscles that are compensating, in order to sort of stabilize the spine and the pelvis. And as we've said, avoid holding one hip higher than the other for prolonged periods. And so this can be in terms of, as we've said, mums quite often balancing a child on one hip, anything where you're repeatedly lifting one hip and leaning, if you're sitting, sort of leaning towards one side more than the other when seated, or, constantly standing sort of with all your weight on one side. Try to avoid doing this. Also, sleeping on one side. If you sleep on your side, quite often the upper hip will bend, towards the rib cage, which actually shortens that space again, between the bottom rib and the top of that pelvic bone, which again is going to shorten the QL on that side. So if you are a side sleeper, try to kind of, change sides if possible. Another thing is arching your back. People with sedentary lifestyles, they may actually sort of consciously think, oh, my back's aching, I better improve my posture. But they kind of overdo it, because what they do is they may then sit up straight, but do it by kind of arching that lower back, that lumbar region, in an effort to improve their posture. But if you hold that arch for too long, what that does is actually it also shortens the QL on both sides, which is going to worsen the problem. So this is where the exercises come in, because if you're doing the exercises to strengthen any weakness and relax any tightness, that will automatically improve your posture. Now, in terms of stretches for the QL, so as we said, when one QL is tight, often the opposite side tends to be stretched and weakened. So in order to improve stability and also correct this muscle imbalance, the stretched side needs to be strengthened, but the tight side needs to be relaxed. So you're not going to treat both sides in the same way. Now, side planks can be used to strengthen the weak side, whereas, massage in particular, and the following exercises that I'm going to give you can be used to really, stretch out and relax the tight side. And by doing this, then, it's possible to get some hip symmetry back, and your posture again will automatically improve as a result. So I'm going to take you through some basic simple exercises now that you can do to help kind of release any tight areas in the QL. Okay, so the first one is this basic kind of overhead reach, where you're going to stand with your feet hip width apart. And so if this is the side that is tight, then you're going to reach over to the side with that arm over the head, and you're going to lean across as far as possible, and hold it for about 20 seconds. And what that will do is that will stretch out where you've got the tightness here, and help just stretch that muscle out. Now, obviously, if you have got tightness on both sides, then you would repeat that going the other way. But if it's a case of maybe you've got some lateral pelvic tilt and it's just the one side that is tight, then you can just do this exercise, going to the one side in order to kind of relax that side and balance out the two QL muscles. Okay, so the next one is a lying down QL stretch. So, and again, you know, obviously if you're feeling that both sides are tight, you would do, you would repeat this exercise sort of on both sides. If you only have, tension on one side, then obviously you'll just work that one side in the exercises. So for example, on this one, we're working on the basis of this lady's right hand side being tight. So you're going to lie face up, extending the arms, out either side, and you're going to bend both knees and then cross. So if it's your right side, as in the picture, that's tight, you're going to cross your left leg over the right leg, and then you're going to keeping the foot on the top there, you're going to let the legs drop across to the left as far as possible. Now obviously then hold for 20 seconds. Now if the tightness is on the left side, then you will cross the right leg over the left leg and let the legs drop to the right. Okay, the next stretch is a 90-degree leg stretch where you will be seated on the floor. Now, we're going to explain this as if the left side is tight. So you're going to put the right hip almost sort of behind you, so that right leg is behind you at a 90-degree angle. And then the foot on the left, you're going to bend that leg in front, also at a 90-degree angle. Then as you reach forward with your left hand, you're going to push, sort of twist around to the side towards the right, and you're going to kind of push that left hip away in the opposite direction to the hand. And what this will do is it will stretch all down the QL area, because you'll be having a twisting motion going one way at the top and pushing the other way at the bottom. Okay, the next exercise is a leg split with QL stretch. So this does require some flexibility in the legs, but basically sit on the floor, legs as wide apart as you can, and then you're just going to stretch over to the opposite side. Try to touch your toes for a really good stretch, but if you can't touch your toes, it doesn't matter. You can just stretch across over the head as far as is comfortable, and so that you feel a stretch along the QL that is tight. And then again, you know, if both sides are tight, you can repeat this on the other side, or you can just do on the one side. Okay, the next stretch is a QL stretch over a stability ball. So basically here you're going to stretch yourself out over one of these gym balls here, and turn yourself onto your side. So if you've only got tightness on one side, then you're basically going to turn onto the opposite side, you know, that isn't tight. So the tight QL is going to be on the top. And you're going to keep both knees on the floor, both feet on the floor rather, one foot in front of the other so that you're a bit more stable, maintaining your balance with one arm on the ground, and then we're just going to again reach overhead as far as is comfortable with the top arm, pulling it away from the hip, and you'll feel a stretch all along that top side where the QL is tight. Okay, now we've mentioned how good yoga is for stretching the QL. A really good pose that's nice and easy to do is the pose of a child, which you can see here, where you're basically kneeling and then sitting back sort of on the buttocks and then just reaching forward as far forward as possible. But we're going to modify it slightly and do this pose with a side reach. So in the child yoga pose, you're going to stretch the arms forward as far as you can, but then you're basically going to walk your hands around to the side. Now you can either do this both ways if you have bilateral QL tightness, or if it's unilateral, you're going to walk your hands out to the opposite side of the QL you want to stretch. So if it's your right side that's tight, then you're going to walk your hands around to the left to kind of lengthen along here. Likewise, if it's your left side that's tight, you'll walk the hands around to the right in order to lengthen the torso as much as possible. And then the last one is a side bend with forward stretch, which I believe is actually also known as the warrior pose in yoga. Basically, you're going to stand up straight, feet wide apart, and you're going to reach out to one side, lengthening the side of the body by pushing the hips down and the arm up. So this top side should be the side of the QL that is tight. And once in maximum stretch, you can then also bend forward, hinging at the hip, and to the side, placing the other hand down on the floor by the foot, which again maintains length in that lower back along the QL. And again, you can repeat on the other side if your tightness is bilateral. Okay, so that's really all the information on QL tightness and pain. Certainly if you feel that this is an issue for you, definitely get it checked out, but also keep an eye out for my next video that I will post on here, which will talk about the different types of pelvic tilt, which certainly are very closely linked to tightness in the QL muscle, particularly lateral pelvic tilt. So do take a look at that. You can subscribe to my channel and you will automatically be notified when that is available. Otherwise, by all means, feel free to comment, or you can message me through my Facebook or Instagram with any questions, and I will do my best to answer you. But for now, that is really it. So I will see you next time. Bye.